we might get started. So yeah, so I'm a physiotherapist. I graduated from the University of Queensland back in 2018. So I've been a physio for almost 18 months now. My dancing history, I started dancing at the age of 3 and continued up until about the ages of 18, 19. I was fortunate enough to be able to travel overseas to do some of my dancing as well, performing at Disney World in Orlando, Florida, and also was accepted into the QUT dance performance and teaching program while I was in grade 11 at high school. So I started that a little bit early. And then I realized that my passions lied elsewhere, and that was with physiotherapy. And so I stopped doing that and continued to finish high school so that I could study physiotherapy. So what we'll just go through now is what we're going to be covering this evening in this session. So first of all, we'll be starting off with the physical demands of dancing and what that entails, go through a few common injuries, we'll talk a little bit about flexibility and hypermobility, the importance of strength training. We'll then move on to a bit about point work and how you know you're ready for point work, or how you can prepare yourself for point work. I'll go through a few dance-specific strength exercises as well, and then talk a little bit about how physiotherapy and dance and what their relationship is there. And then we'll have time for some questions at the end. Okay, so just a reminder, you're more than welcome to ask questions throughout. If I see them, I will make sure that I try and answer them. If not, I'll definitely answer them all at the end. Okay. All right, so the physical demands of dancing. So as we're all well aware, especially if you're doing ballet or contemporary or classical type genres of dancing, extreme ranges of motion are quite ideal, and we often are asked to perform big elongated movements towards the end of ranges, especially in the back, the hips, the ankles and the feet. So this is more specific to ballet and your classical types of dancing, but then also things like acrobatics and gymnastics and cheerleading as well. Often there's a lot of repetitive movements and sequences as well. So we repeat the same movement over and over again, the same section of a dance, the same sequence, or the same dance over and over again for performances and rehearsing as well. Dancing requires a high level of coordination, balance and neuromuscular control. So being able to selectively isolate different muscles, different joints, and do different things with each side of the body, and do things on one leg or in awkward positions and whatnot. So it's a lot of coordination and balance and control involved. And then also with dancing, it tends to be that people do a lot of it. So you have all your different genres that you'll usually practice throughout the week. You'll potentially do independent practice as well as your own, as well as your class and scheduled I guess rehearsal times as well. So we tend to do a lot of it, and I definitely myself know that there was at one point I was doing 20 to 25 hours of dancing in a week. So it can be quite a lot for people as well. And so I guess with those demands, especially the range of motion, some people, I guess, have this genetic predisposition where they are able to move a lot more easily or move a lot more than other people. So we'll talk a little bit more about that in a moment. So this is just a list of some of the common injuries for people who do participate in dancing or similar sorts of sports. So most of these are overuse injuries, so such as your stress fractures, your tendon pathologies, shin splints, and then some other soft tissue injuries as well. And so this is due again to that repetitive nature of dancing, and then also the I guess the amount of volume of practice and training that we do as well. There are a few other injuries in here that are more your traumatic type injuries, so your sprains and strains, so your ankle sprains or knee ligament sprains as well as your muscle strains or muscle tears as well, or labral injuries of the hip as well. So there's a few different ones in there. That's not all of them. That's just some of the common ones that I guess we're at risk of developing participating in dancing. Okay, so I'll move on to a little bit about hypermobility. So the scale that we use to measure hypermobility is called the Baton scale. And usually if you score higher than a 4, that indicates that you've got some generalized hypermobility or ligamentous laxity. So uh, everyone has a different degree of stretchiness of their ligaments and the capsules that surround their joints. And so some people just tend to be a little bit more stretchy than others. Now, if you are tend to fall on that higher end of the scale for ligamentous laxity and capsular laxity, there's actually a greater incidence of injury in that population. And that's usually due to having poorer feedback mechanisms when it comes to movement. So there's less information coming from those tissues surrounding the joints to our nervous system. So we're unable to respond quick enough or change how we move, or we might be moving in patterns or ways that are not optimal for loading, and that puts us at risk of injury. There's also a negative association between being more hypermobile and success. And that's usually because dancers who are a little bit more hypermobile have discontinued due to pain or injury for those reasons I just mentioned. So in this population, strength and motor control training are very, very important and something that must be done and very crucial for injury prevention and also just for performance enhancement as well. All right, so moving on to flexibility. So flexibility is, I guess, how flexible you are, and it can be determined by a lot of things. So hypermobility was more so due to your soft tissue stretchiness, so that capsular and ligamentous stretchiness. Flexibility takes into account a few other things as well. So turnout and other degrees of flexibility, so that includes your splits, especially your side splits, not just your front splits. And other things as well, determined by your anatomy, so how your joints are actually made up and what shapes they are. Your ligamentous and capsular laxity, like we just spoke about. Your muscle strength, so the actual strength of the muscles to pull you into that particular position. So for example, a front kick or a high kick or a développé or a penché, do you actually have the strength to pull yourself into that position? Or in a jeté, are your legs strong enough to pull your legs apart that far? And then the other thing that to take into account is the nervous system sensitivity as well. So it's quite common sometimes when you're stretching or doing other things or exercising that you may feel a bit of a tingle or a bit of a funny pull that doesn't feel like a muscle pull, and that can sometimes be the neural tissue that's giving you those symptoms. And so there is a way to address that as well. And so sometimes it's the nervous system that's actually stopping you from stretching and they don't want to be stretched. Okay, so this is a common question that I get asked quite a bit is, do I stretch or don't I stretch? And what's the research like there? So there's two types of stretching. You have your static stretching, which is the one where you hold a particular position for a sustained amount of time. And then you have your dynamic type stretching, which is the stretching when you're moving around and you're not particularly holding one position. So your static stretching is more so for those joint capsules and connective tissue. So again, there are people out there who I guess more designed for this sort of stuff because they do have that stretchy kind of tissue, so they tend to stretch a lot more easily and they can get to their splits a lot quicker, or they can kick a lot higher, and they probably fall into that category of the stretchy connective tissue. And then you have your dynamic stretches, or what we call eccentric type stretching, which is when we're lengthening a muscle as it is contracting. So if you think about a bicep curl, as you bring your arm up towards and you bend your elbow, that's the concentric. So the muscle is contracting and shortening, and then an eccentric is when you're lowering the weight. So as you're lowering the weight, the biceps is still contracting to control that lower, but it's actually getting longer as it does that as well. And so that stretching is more directed at your muscle tissue. Okay, and then we have our nerve glides, which are a kind of dynamic type stretch directed more so for the neural tissue, and they're there to desensitize the nerves to movement and stretch. The important takeaway point from this slide is that static stretching has shown little to no evidence to prevent or reduce the risk of injury. And so it's very common for people to as a warm-up, to do some static stretching, or to sit in their splits, or to try and touch their toes, or do their groin or hamstring stretches. And there's been no association with stretching and reducing your risk of injury. And so it's very common in sport to see people do that. And if you've watched the Olympics over the years, or any kind of performances over the years, is that you've probably noticed that the athletes and the performers, they don't do this as much anymore. And you're better off actually doing more of a dynamic warm up, where you're getting your blood flow going, getting your heart rate up, increasing your body temperature, so that your tissues are ready to go and participate in the class, or do the performance, or do the exercise that you're wanting to do. Now, what does this mean if you are actually trying to increase your flexibility, which is why I see a lot of people, is they come to me asking to increase their flexibility. And so this is best to do when you are warm. So you can do static stretching. So it's not that static stretching is unsafe to do, it's probably just not the best way to increase your flexibility. So if you are going to do it, definitely do it when you're already warm. So after class, or when you've already done some sort of exercise, whatever that may be. And actually your strengthening and dynamic exercises are the best ones to do. So actually strengthening up the muscles that are working in that range that you are trying to improve, and strengthen those up so that they actually have the capacity and the strength to pull you into that position, and increase your range of motion. So this is kind of a few examples of some exercises for a warm-up, and then also example of the nerve glide. So we have a grand battement from the first one, and so this is an example of a dynamic exercise. So swinging your leg forwards and backwards, slowly increasing the range. And this is a very good one for the hamstrings and the hip and the calves, and getting that nice stretch through the back of the leg there. And then also for the front, the quadriceps and the hip flexors, as well as you bring your leg into derriere, behind into arabesque. A port-de-bras, another good one for the back of the leg and the front of the leg as well. You also get the back and the abdominals in there as well. So moving through these motions quite slowly and progressively. And they're also best to do after you've already done a bit of a warm-up as well. So some star jumps, some slow jogging, or anything else that can increase your heart rate, increase your blood circulation, and your body temperature as well, so everything's ready to go. Now on the bottom right there, you'll be able to see the nerve glide here. And so if you imagine a piece of string coming from your lower back, around the back of your hip and your leg, down into your foot, we imagine that as our neural tissue. What we're doing is we're stretching it and slacking it repeatedly. So bending your knee up and down, and you kind of tension the nerve, then let it go, then tension the nerve and let it go. And you repeat this, and this is almost like we're flossing the nerve within the tissue in the leg, and so it becomes a little bit less sensitive to movement and stretch. All right, so moving on to, I guess, the main takeaway point from today is the importance of stretching. So, and strengthening, sorry, not stretching, take that back. So the main muscle groups. So obviously our lower limb muscles are going to be very important. So particularly the calf, the quadriceps, hamstrings, and the hip muscles as well. Moving on to the trunk, the abdominals and the lower back, very important for stability, control, and balance. And then we have the upper limb muscles, so particularly the scapula and the shoulder stabilizers become important, especially in dancing genres that require any weight bearing through the hands. So that can be things like your cheerleading, acrobatics, gymnastics, contemporary dancing, or hip hop dancing, especially if you're doing breakdancing as well. So very important to work on. When it comes to ballet, classical types of dancing, upper limb strength is very important as well. So it's often that you have to hold your arms above your head or keep them up for an extended period of time. So you need the strength and endurance in those muscles to hold them there and keep them there and keep them in that nice, pretty position that you want to maintain. So we strengthen the muscles for a number of reasons. One, so we can support those joints at those extreme ranges of motion. So when you are in an arabesque, or if you are doing a high kick, or if you are jumping up into the air, or doing a maneuver on the ground, is you want to have that active, strong support around those joints, especially when we're putting our joints into a very, in a position where they are working towards that very end of range. The next thing is strengthening the muscles allows us to do those consistent repetitions. So being able to have the loading tolerance and the resilience in those tissues so that we can repeat a move, especially in something like a petit allegro, where you're doing a lot of quick little movements faster and faster and faster and repetitively, helps us to reduce the risk of any overuse injuries as well. And then again, strengthening can help us improve our flexibility and range of motion. So especially when it comes to turnout, it's all about having good, strong hips. So we want those external rotators, the muscles that actually pull our hips out, to be nice and strong so that they can actually keep us there. And there was actually a study done in the Australian Ballet in the early 2000s. Dr. Sue Mays was the physio there at the time, and she looked at doing a calf strengthening program with the ballerinas at the time, and told them to actually stop stretching their calves, and followed it over time, and she actually found that the incidence of injury of calf tears or ankle sprains and any other injuries around the foot and the ankle actually reduced. So it just goes to show that strengthening is very important when it comes to injury prevention. So these are just a few exercises that are very good to address the muscle groups, the movement patterns, and the techniques often used in dancing. Now, if you had a particular injury or area of concern or something that you're wanting to work on, there are obviously more exercises than this that can be used. This is just a kind of general whole body kind of exercise, group of exercises that if you're at home and you are doing dancing from home via Zoom, which I know a lot of schools are, this is a great thing to kind of implement into your warm-up or into your cool down, or on another day where you don't do dancing, to maintain that strength. And we're getting all the good muscle groups around here. The other thing is that the guidelines for physical activity for all adults and younger children and adolescents as well is to get your 150 minutes of exercise per week, and that's your puffy kind of exercise where you're getting out of breath. So you'll probably get that with dance class or any other cross training you do, such as running or cycling or swimming or any other sports that you play. But then they also recommend that you have at least 2 strength sessions per week as well, and that doesn't have to be in a gym. That doesn't need to require any fancy equipment. You can do this all at home with no equipment at all. So let's just run through these exercises here. So the first one we have is a single leg calf raise, so pushing up onto your toes to work that calf muscle in the back. Now you can do this on a step as well, and you can actually do it on 2 feet if your strength's not quite there for 1 foot as well. So this is a very, very important one, and one that I will definitely look at with every single person that does dancing. As every single person that comes in, I will make sure I look at this. Next, we have a single leg deadlift or an arabesque. So this one's more so looking at your hamstrings, the hip muscles, so the gluteals, and your lower back as well. And so this is that eccentric strengthening I spoke about. So this is a very good one for flexibility. So we're actually putting that hamstring on load because it's going to stop us from tipping forward. So the hamstring is contracting to stop us from falling forward, but it's actually also getting a very good stretch as we do this as well. So it's that eccentric kind of loading pattern through here. Down on the bottom left here, we have a side plank. And this can be done on your feet or your toe, your feet or your toes, or on your knees even as well. And this one's a very good one for the shoulder as I spoke about before, so that stability around the shoulder. We also get our abdominals and our oblique muscles going as well on the side of our trunk, and then also very good for the hip and gluteal muscles as well. So again, very important when it comes to balance, turnout, and injury prevention. Next, on the bottom right here, we have a single leg squat with a hip abduction, which is pushing your leg out towards the side. And again, very good for the gluteals. We also get the quadriceps going with the squatting action, and then the lower back as well. Now here in the picture, I am doing it with a Swiss ball, and you can do it with a Swiss ball, or you can do it with any ball, or you can do it with a towel, whatever you prefer. And that's a very good one for training that balance and again, turnout as well. And the last two, up the top here, we have a dead bug, which is a more abdominal focused exercise, but we also get a little bit of pelvic floor, which is important in dancing, especially because there's a lot of jumping in a lot of them. And then we also get our hip flexors going along the front of our hip as well. And then on the bottom here, this is not one that many people expect when they think of dancing, but push-ups. Again, you can do these on your feet or your knees. And it's a bit of a whole body exercise, so they're very, very good. So we get our arms, we get our shoulders, we get our abdominals and our lower back for maintaining that plank position. And as I said, these are not all the exercises. These are just the ones that I think are very, very good for a general conditioning program for any dancer out there that needs to maintain their strength or improve their strength. Okay, so we'll move on to a little bit about point work now. So there's a lot of things to take into consideration, a lot of factors that come to play when determining point work. So age and maturity. So how early is too early, and how late is too late. It depends on the person. It really depends on how long they've been doing ballet for, and if they've got a good history of ballet, so a good 2 to 3 years of consistent ballet practice, and they've been doing that for quite a while. And then also thinking about maturity with regards to skeletal maturity as well. So how well the bones have developed, dependent on age. You also may want to consider your injury history. So do you have a history of ankle sprains or recurrent ankle injuries or knee injuries or anything like that? And is that the most appropriate thing for you to be doing now? Or do you need to do a good point preparation program so that you have strengthened up your area of concern or vulnerability so that you can go on point? The next thing is strength. So at least 25 single leg calf raises consecutively for each leg. This is a very important point that if you haven't quite got that strength there, then that's something you definitely want to get under control and grasp before you consider point work. And then also thinking about the muscles within the feet as well. So that's the intrinsic foot strength. So a lot of people, before they do point, your teacher may ask you to do the doming, which is the activation of those muscles within the foot and lifting that arch up in the foot. If you take a look at the Facebook event page, I did post a video with a few other little intrinsic foot exercises that you can take a look at, like lifting up your big toe or your other 4 toes independently of each other, and that's another way to work on that intrinsic muscle strength. Range of motion. Now, the big obvious one is how much point do you have? So ideally you have 180 degrees of ankle and foot plantar flexion, so it's completely flat when you point your toe. However, this isn't completely necessary to go on point. You don't have to have 180 degrees, but it does help. Next is looking at the flexibility of the tissues underneath the foot. So that's your flexor hallucis, which is the muscle that bends your big toe. And so we look at that by going into a demi-plie and then bending up your big toe and seeing what the flexibility is there and seeing if you have symmetry on both sides. Next, we have a little bit of a look at the hip external rotation, so the outward rotation versus how much internal rotation you have. And so if you have a very big ratio, which most dancers tend to do, is they tend to have a very wide range of motion of that outward rotation, and then very minimal internal rotation. And that's actually one of the risk factors and predisposing factors to injury as well. So usually it's often you have to actually work out of turnout and into more parallel or inward rotation positions to strengthen up those other hip muscles. And then the other thing, looking at your ankle plie range. So seeing if you can get at least 8 to 10 centimeters on the knee to wall test, which is where you've got your foot flat and then you're going to bend your knee to try and touch a wall while keeping your foot flat, and see if you can get your foot, your toes 8 to 10 centimeters away from the wall and still get your knee to touch the wall while keeping your foot completely flat. All right, so some other things that are good to look at are balance, coordination, and landing. So one test is called the airplane test, which kind of looks like this deadlift arabesque that we've got down here. So tipping forward into that arabesque position, are you able to maintain your balance and bend your knee down so that your fingers touch the floor while keeping that horizontal trunk and leg at the back there? And are you able to do 8 of those without losing your balance and maintaining good technique? The next is the single leg releve hold. So that's actually pushing up onto your toes on one leg and holding it there for approximately 10 seconds. So this is not only a test of the strength of the calf, so holding that contraction independently, but also your balance. So hands on your hips or in fifth or first. Are you able to hold yourself up there for 10 seconds without losing your balance? This is a tricky one that often takes a fair bit of practice. Next, I'll often look at changement. So looking at you changing your feet between fifth and in your fifth position and your third position. And I'm mainly looking at how you accept load through your feet and your knees and your hips, and how your feet move and how they change with your landing, and if there's any way we can optimize the strength or the load patterns there. And then tempe leve, so a single leg hop basically, and so looking at your landing on one foot and how you accept load, and also your push off as well is very important. So when it comes to pre-pointe assessments, what the dance teacher is looking at versus what I'm looking at as a physio. So dance teacher is often looking at your technique, your performance, how efficient, how effective you are, and those sorts of things, where the physio is more so going to be looking at your strength and your neuromuscular control and coordination and those sorts of things, more so determining kind of, are you at risk for any injuries, and if you are, how can we reduce that risk? So a little bit more about the relationship between physios and dancing. So we do injury assessments and rehabilitation. So if you've sustained an injury through dancing, or even through your cross training and you're trying to get back to dancing. So if you do dancing, but you also run on the side and you've sustained an injury running, we can help you with your dancing as well. We do pre-pointe assessments, as I said, and also preparation programs. So if you know you've got a pre-pointe assessment coming up at your school, what can you do to best prepare to make sure that you do really well and you pass? And then also ensure that you're going to be safe when you go on point as well. So you've got enough strength and coordination and control there, and that you're going to reduce your risk of injury. We also work a lot with performance enhancement. So are you wanting to increase your turnout? Do you need some help with the hip strengthening or movement patterns? Do you want to be able to jump higher or jump further? Do you want to increase the range of any kind of split or jump or arabesque? We can help you with that. And then also cardiovascular fitness as well. So if you are increasing the amount of volume of dancing that you're doing or the intensity, do you have the fitness there? Do you need some help with that? And exercise physiology helps hand in hand with that as well. And then the other thing is injury prevention programs. So if you are susceptible to a particular type of injury, or you are hypermobile, or you do have a history of other injuries, can we help rehabilitate that and give you a bit of an individualized program to address that? It's a new exciting announcement. I will be starting some live Facebook videos on a Saturday at 4 o'clock called ISO Dance with Target Physio. And so what I'll be running is a live workout I guess, specific for people who do participate in dance or even just like dance. And each week there'll be a different skill or body area focus. It may be strength, it may be fitness, it may be motor control, it may be flexibility, and it will be around 20 to 30 minutes, and I'll run through it. And it'll be there on our Facebook. So you don't have to do it at the time. You can do it the day after or later in the week if you wish as well. And I'll go through a few things there on our Facebook as well. Okay, so that's all from me. I will now open up the floor to questions. So what I'm going to do is just stop this here. And if you do have any questions, please send them through. I will hang around for 5-10 minutes to ask any. The other thing you can do is if you have a bit of a question that you prefer to ask me individually, if it's more specific to you, you're more than welcome to send me an email. So my email is Jenny, Jenny, at targetphysio.com.au. So you're more than welcome to send me a message there. Okay, so we have a question here. What are the best ways to improve plantar flexion and improve your range of motion for your front splits? Okay, so great question. This is a very common one that I see. So improving your plantar flexion, so improving your point. A great way is if you have one of those stretchy bands that you often practice point with. So putting that around the front of your foot and then pointing into the band. So what that's going to do is not only strengthen the calf muscle at the back, which is the plantar flexion muscle, but it also strengthens all the pointing muscles in the feet. So those muscles that actually flex the foot and curve the arch of the foot as well. So if you have a band, pushing into that band and even doing holds there is a really nice way to do it as well. So improving the endurance of those muscles. So I'd be starting with something like 10-second holds to begin with. Again, depends on your strength and your endurance, so it becomes a little bit more specific there. The other thing to do is those single leg calf raises. So where you're pushing up onto your toes and working into that plantar flexion position. Really good for the calf and then also the foot as well. And again, you can do holds with those, so push up and work into those holds. With regards to your front splits, so that's a lot to do with your hamstring and also your hip flexor mobility as well. So the exercise that I showed on the slide, the deadlift or arabesque exercise where you're tipping forward on one leg to get those hamstrings working. That's a great one to do where you're getting that stretch and strengthen at the same time. The other things you can do are like the front and backwards kicks as well. Now, if your front splits, you can do static stretching to try and achieve your front splits as long as you're doing that after a dance class when you're already warm, when you've already done some dynamic warm-ups as well. So you can do different types of stretching there. I have got this kind of stretch flow that I personally do myself. It's a bit more yoga type based that I do kind of quickly, and I never hold anything for longer than 20 seconds sort of thing, that I'm happy to post in the event page for people to try and see if that works as well, which does work, stretch a lot of those movements and positions that are important for your front splits. All right, so we have another question. What is the focus for this Saturday's workout? This Saturday's workout is going to be on feet mostly. So we're going to be looking at a lot of the foot strengthening exercises, how to maintain your point, how to keep your point nice and strong, and how the foot is important when it comes to things like balance and landing as well. So we're going to be looking a lot at the feet there. Another question, what is the best way to improve balance when doing things like a pointe? Okay, so what you can do initially is go into your pointe and pop one finger on the ground. So the more that you increase your base of support, the easier it is to balance. The more that you reduce it, the harder it is to balance. So when you're on a pointe, you've obviously only got your one foot on the floor. So depending on how big your foot is, that will determine your base of support as well. But it's also very good to see if you can get someone to take a picture or a video, or if you can look in a mirror of how you're doing your pointe and see if where your weight is being distributed. Sometimes your weight might sit a little bit further that way because your leg's a little bit to one side, or your leg might be a little bit to the other side. And so that can determine a lot where your center of gravity is in relation to your base of support. Now, balance is one of those things which takes a lot of strength and also power as well. So even though you're trying to stay still, we need those quick firing actions of our muscles to adjust our balance as well. So training things like jumping and those plyometric type strengthening exercises like jump squats, jump lunges are actually a really nice way to improve your balance as well. So training that power and the reactive balance as well. The other thing that becomes very important is the strength around the hip and the foot. So when you're in a pointe and your knees obviously extended, your foot and your hip are going to be the main things that are going to control where your balance is and how you maintain your balance. So things like those strengthening exercises of the foot, the calf raises are very good for that as well. You can even chuck a band around your ankle and attach it to a table as you do the calf raises and see if applying different bits of tension in different ways makes that a little bit more difficult or easy for you. And then the other thing is hip strengthening as well. So those deeper hip muscles are very important when it comes to your stability and maintaining your trunk on your leg as well. So use strengthening up those hip muscles with any rotational or squatting type actions, or even the side plank is a very good one for that sort of stability as well. You're most welcome, Lauren. Thank you for your question. I'll hang around for a few more minutes in case there's any other questions. But yeah, just a reminder that this is being recorded. So if there's anything that you missed or you're unsure about or you want to watch again, it will be on our YouTube channel tomorrow. And yeah, stay tuned on our Facebook for the first ISO dance coming on Saturday, which the focus will be feet. So there will be a little bit of a workout. I'll be talking as we do it as best I can. And so I will see you then, hopefully. And again, you can access those ISO dance videos at any time as well. They'll be made available to watch at a later date if needs be. All right, we've got another question here. How do I improve my turnout from my hips? Okay, so your turnout is determined by a lot of things. The factors that we can control are the strength of the turnout muscles. So those muscles that are externally rotating our hip and rotating our hip out. So you can strengthen those muscles in many ways. So the exercise that I showed before where you're doing the single leg squat with your hip pushing out into the wall, or a ball on the wall, is a very good place to start. That is really working those external rotational muscles. You may have also seen exercises such as crab walks, where you're walking with a band around your toes side to side to work your external rotators. You can do that as well. And also isometric contract relax exercises are very good for improving range of motion as well. So actually contracting the opposite muscle and then moving into your turnout is a nice way to do it as well. So you can do this in a few different ways, and this contract relax is more applicable to I guess dancers that are a little bit more experienced, not so much in the younger dancers, so more of your adolescents and younger adults this works best for. And so you actually want to turn on your internal rotators and then go into external rotation. So there's one way that you can do this is lying on your back, and you bring your leg up into tabletop. So your shins are sitting flat and your knees are coming directly over your hips. From there, you want to actually turn your hip in. So when you turn your hip in from that position, your foot will come out. Notice it gets a little bit confusing. It's a bit of a brain game. And so your foot will come out as your hip turns in, and you want to hold that for approximately 10 to 15 seconds, and then try and go into your turnout from there. The other thing you can do are more dynamic type exercises as well. So I've seen a lot of girls doing the clams, where you're lying on your side with your knees together and then opening your knees up as if it's like a clam or a shell, and you can pop a band around your hips, and that will increase the strength there even more. With regards to trying to turn your hips, improve your turnout from your hips with a static stretching point of view, you can do it, but probably not the best way to do it, and you're better off doing those strengthening and more dynamic type exercises. So doing pliés in second and doing your grand pliés in second are a very good way to do that as well, and then also doing your grand battements in a full turnout position to work those hip muscles and the hip muscles on the front of the hip as well to support that area is a really good way too. Also, I didn't realise until just before that it's International Dance Day. So it's very, it's a nice way to be spending International Dance Day with everyone here today. And I hope that everyone's learnt something valuable and insightful and they can take something home with them. More than happy to answer any other questions, as I said, via email, or you can give the clinic a call or check out our website. There's a bit more information on there, and our Facebook page as well. But yes, that's about it. I'll hang around for another 2 minutes, and then you guys are more than welcome to contact me via any other way, and send me an email or give the clinic a call as well. Thank you to everyone who's leaving lovely little comments. Thank you so much for coming along. I'm glad it's been good, and happy International Dance Day to everyone that's wishing me a happy International Dance Day as well. Thank you very much for all your engagement and questions. It's very good. And hopefully I'll see some of you on Saturday for the live workout on Facebook. And the focus will be feet, and so we'll do a little bit of a workout, get our heart rates going, get a little bit puffy and sweaty, and also get our feet nice and strong and work on some little drills and things there. And if you want any more information, if I think I have answered all the questions, but if you would like a little bit more detail or anything more specific to you, please let me know as well and send a little message or an email, and I'm happy to give some more specific information to people as well, based on what you're experiencing. And if you want to let me know about any dance things that you've been doing on International Dance Day, or it's AusDance, it's their dance week this week, so they're encouraging people to get on the socials and show what they're doing for all their dance this week. So get around that and get engaged there. And also if your dance school is doing Zoom classes as well, then let me know, and I'm interested to hear about how that is going and how that's working for everyone as well. Thank you for everyone for all your messages. So what I'm going to do now is I'm just going to end this here, but you're more than welcome to, again, to ask any questions, and I hope you've all had a great day and have a good evening. Thank you very much.